medical professionals lying to and blaming patients for issues isn't something that I feel does happen. But I can totally appreciate where this comment comes from. In my NHS experience, the issue is more of a disconnect between departments and services and organisations within the NHS. So, for example, somebody in the lab may damage a sample, and the only option to get a repeat sample is to say that there wasn't enough sample damage. When that's relayed to the GP surgery may interpret that as that it was a patient issue and may relay that. Throughout that process, I don't think anybody has negative intentions or is lying and wanting to blame patients. It's more of a misunderstanding. What I do fully agree with is that this is a real issue, because that perception of blaming patients or lying and not being honest does mean that people don't trust medical professionals, don't trust the processes. From all these threads we've been having the last couple of days just about stool sample collection, people are choosing to not return their samples, to not access healthcare services because they're worried, because they've been given a lack of instruction, because when they ask for direction and guidance, the people that they're asking, the medical professionals they're asking, don't have the answers. That's concerning, that's worrying. And I guess what I'm learning from the last couple of days is that something as simple as an instruction flyer in that sample bag would go a really, really long way to help people, to give patients confidence and to encourage people to access services, which I do truly believe all medical professionals want that. I don't think there is a culture of lying to or blaming patients. I think it is a disconnect between the various departments within an organisation, and the fact that the NHS is multiple organisations as well. It's a tricky environment to work in, not an environment I work in anymore. For some reason I chose local government, also a tricky environment. But yeah, I can understand this comment completely, but I just want to highlight my experience is that medical professionals don't lie to and don't blame patients, not intentionally. It may be perceived as that because of other organisational issues though.